very warm welcome to all of you. In this lecture, we will be talking about structural classification of muscles. Diaphragm. It is a dome-shaped muscular fiber sheet which separates the thoracic from abdominal cavity. Upper aspect is convex and lower is concave one. The muscular fibers may be grouped into three parts: sterna, costal and lumbar. The curae are tedious in structure at their attachments. The right crus is broader and longer than the left one. The diaphragm is for passage of structures between the thorax and abdomen. Three large openings: the aortic, the esophageal and the vena cava. There are some smaller openings also. The diaphragm is supplied with motor fibers by parotid nerves. The lower 6 or 7 intercostal nerves distribute sensory fibers to the peripheral part of the muscle. Superficial fascia of abdomen. Most of abdomen consists of a single layer containing a variable amount of fat, but in obese people, lower part consists of many layers. Superficial fascia is divisible into two layers between which are superficial vessels, nerves and superficial lymph nodes. Superficial layer is thick, areolus in texture and contains meshes. Below it passes a superficial fascia of thigh. Deep layer is more membranous than superficial and contains elastic fibers. Oblique externus abdominis. It is the largest and most superficial of the three flat muscles of region. It arises from external surfaces and inferior borders of lower 8 ribs as 8 fleshy slips. These are arranged in oblique lines extending downwards and backwards. Aponeurosis of external oblique is a strong tedious sheet directing downwards. Nerve supply is from lower 6 thoracic spinal nerves. Oblique Internus abdominis. It is less bulky and thinner. It arises by muscular fibers from upper surface of inegual ligament, from ventral segment of crest and thoracic lumbar fascia. The anterior layer blend with the aponeurosis of transversus abdominis. Nerve supply is by ventral rim of lower 6 thoracic and first lumbar spinal nerve. Cremaster. It consists of a number of loosely arranged muscle fascicule lying along spermatic cord. They are united by alveolar tissue to form the sac-like fascia around the cord and testis within external spermatic fascia. Nerve supply is from genital branch of genital femoral nerve, which is derived from first and second lumbar spinal nerves. Cremaster pulls up testis towards the superficial inguinal ring. Pyramidalis. It is a triangular muscle in front of lower part of rectus, abdominis and within its sheath. The muscle passes upwards, diminishing in size as it ascends and ends in a pointed extremity attached to linea alba. It is supplied by subcostal nerve. Function of it is to provide a firm but elastic wall to retain the abdominal viscera in position. Linea alba. It is a tedious rift between the xiphoid process and symphysis pubis. It is between the rectiformed by interplacements of fibers of aponeurosis of oblique and transverse. Transversalis Fascia. It is a connective tissue stratum between internal surface of the transversus and extraperitoneal fat. It is a part of general layer and fascia between the peritoneum and abdominal wall. In inguinal region, it is thick and dense. Deep inguinal ring. It is situated in the transversalis fascia. It is in midway between the anterior superior iliac spine and pubis, about 1.25 centimeters above ligament. It is oval and long. Axis is vertical. It is larger in males. Inguinal canal. It contains spermatic cord or the round ligament of uterus and ilia inguinal. It is oblique and 4 centimeters long, going downwards and medially. It extends from deep to the superficial inguinal ring. Quadratus lumborum. It is an irregularly quadrilateral posterior muscle of abdomen. It is broad inferiorly. It is attached below by aponeurotic fibers. Anterior to quadrates, lumbrin are colon, kidney and diaphragm. Nerve supply is from ventral rim of 12 thoracic and upper 3-4 lumbar spinal nerves. The quadratus lumborum fixes the last rib and acts as a muscle of inspiration. Levator Ani. It is a broad, thin muscle attached to inner surface of true pelvis and unites with the opposite muscle to form the greater part of floor of pelvis. In front, it is attached to the pelvis surface of the body of pubis. Behind, to the medial surface of ischium. The muscle fibers pass towards the median plane with the varying degrees of obliquity. Morphologically, it can be divided into pubococcygeus and iliococcygeus. Levator Ani constricts the lower end of rectum and vagina and perineal body. Muscles of pelvic floor. Sphinter Ani Externus. It surrounds the lowest part of anal canal. Below it is adherent to skin. Above it overlap the Sphinter Ani Internus. Bulbospongiosum. It is in the median line of perineum in front of anus. It arises from median tendinous rift. Its fiber diverges like two halves, which helps in emptying the urethra after the bladder has expelled its contents. Ischiocavernosus. It covers the crus penis. It is attached by tendinous and fleshy fibers to the inner surface of ischial tuberosity. The muscular fibers end in aponeurosis attached to crus penis. It compresses the crus penis and so plays a part in maintaining erection of the penis. Trapezius. It is a flat, triangular muscle extending over the back of neck and the upper thorax. The superior fibers proceed downwards and the inferior upwards and the middle horizontally. It is supplied by accessory nerve and by sensory branches from ventral rim, third and fourth cervical spinal nerve, acting with outer muscles attached to the scapula. The trapezius controls its position. Muscles of upper limb. Latissimus humerus dorsi. It is a large triangular flat muscle extended over lumbar region and lower half of thorax from spine of lower 6 thoracic vertebra anterior to trapezius. Latissimus dorsi with teres major forms posterior fold of axilla. Nerve supply is from thoracodorsal nerve from posterior cord of branchial plexus C6, C7 and C8. This muscle is active in movements of adduction, extension and specially medial rotation of the humerus. It takes part in all violent expiratory movements. Pectoralis major. It is a thick triangular muscle arising from the anterior surface of sternal half of clavicle and anterior surface of sternum. Clavicular fibers are separated by sternal fibers by a gap. Muscle is attached to humerus. The number of costal attachments varies. The rounded lower border of muscle forms the anterior axillary fold. Nerve part of pectoralis major may act together or separately in adduction and medial rotation of the humerus. Levator Scapulae. It is attached to the transverse process of the atlas and axis and to the third and fourth cervical vertebrae. It descends diagonally to be attached to the medial border of scapulae. It is supplied by third and fourth cervical nerves. It descends diagonally to be attached to the medial border or scapula. It is supplied directly by third and fourth cervical nerve and from fifth cervical through dorsal scapular nerve. In association with other muscles, it helps in movements during active use of upper limb. Serratus Anterior. It is a muscular sheath which passes backwards around the thorax from large costal attachments to a limited attachment of scapula. Nerve supply is from C5, C6 and C7, which descends on external surface of muscle. It draws the scapulae forward. When muscle is paralyzed, the lower angle of scapula stands out prominently. Deltoid muscle. It is a thick muscle like Greek letter delta. If we attach to lateral third of clavicle, the muscle converges into a short and substantial tendon attached to the deltoid tuberosity. Nerve supply is from axillary nerve C5 and C6. Muscle is able to act in a part or as a whole. Anterior fibers cooperate with pectoralis major in drawing arm forward. Posterior fibers draw arm backwards. Infraspinatus muscle. It is a thick triangular muscle occupying most of the infraspinatus fossa. It arises from medial 2/3 of fossa. The fibers converge to a tendon which glides over lateral border of spine of the scapula. Muscles of the back. Teres major. It is a thick flattened muscle which arises from inferior angle of scapula. The fibers are directed upwards and laterally ending in a flat tendon. Nerve supply is from lower subscapular nerve C6 and C7. The teres major draws the humerus medically backwards and rotates medically. Biceps Brachii. It is a large fusiform muscle in the flexor compartment of upper arm. Short head arises by a thick flattened tendon from apex of coracoid process. Long head starts with a fibrous capsule of shoulder joint. Each tendon is elongated muscular belly and the two bellies closely attached. Nerve supply is from C5 and C6. The biceps is a powerful supinator. Next is triceps. It is of larger size and arises by three heads long lateral medial. Long head arises from infraglenoid of scapula. Lateral head arises from shaft of humerus. Medial head is narrow and arises from humerus. Nerve supply is from C6, C7 and C8. Separate branch supplies a separate head. Triceps is a muscle of extension of forearm at the elbow joints. Pronator Teres. It has humeral and ulnar attachments. The humeral head is larger, more superficial and arises from medial epicondyle. Much smaller ulnar head arises from medial side of ulna. Nerve supply is from C6 and C7. It rotates the radius upon ulna, turning the palm of hand backwards. It is also a wheel flexor of elbow joint. Flexor carpi radialis. It arises from the medial epicondyle by the common flexor tendon. Its body is fusiform. In lower part of forearm, radial artery is between the tendon of this muscle and that of Brachii radialis. Muscles of forearm. Nerve supply is by median nerve C6 and C7. It flexes the wrist. Acting with the radial extensors of wrist help to abduct the hand. Palmaris longus. It is slender, fusiform and medial to flexor carpi radialis. It arises from the medial epicondyle. It ends in long slender tendon. Nerve supply is median nerve C7 and C8. This muscle flexes the wrist and may act as extensor of palmar fascia. Flexor carpi ulnaris. It arises by two heads, humeral and ulnar, connected by tendinous arc. Humeral head is small and arises from the epicondyle of humerus, ulnar head from medial margin of epicondyle. Nerve supply is from C7 and C8. Flexor digitorum profundus. It arises from ulna. Muscle ends in four tendons. It forms most of the muscular elevation felt on dorsum of forearm. Nerve supply is C8, T1 and intraosseous branch of median nerve. Brachioradialis. It is the most superficial muscle of the forearm. It arises from upper two-thirds of lateral supracondylar ridge. Nerve supply is from radial nerve C5, C6 and C7. It is a flexor of elbow joint. Psoas Major. It is a long fusiform muscle lateral to the lumbar region of vertebral nerve L1, L2 and L3. It flexes the thigh. Gluteus Maximus. It is the largest and most superficial muscle in the region. It is a broad and thick quadrilateral mass. It forms prominence of buttock. Nerve supply is from inferior gluteal nerve L5 and S1 and S2. It can extend the flexed thigh and bring it into line with the trunk. Gluteus Maximus. Gastrocnemius. It forms the belly of calf. It arises by two heads. Nerve supply is from tibial nerve S1 and S2. Flexor helicolis longus. It arises from the inferior two-thirds of posterior surface of fibula. The fibers pass obliquely down to a tendon which occupies nearly the whole of posterior of muscle. Nerve supply is from S2 and S3. Calf muscles. Flexor digitorum longus. It lies medial to flexor helicolis longus. It is thin and pointed proximally. It gradually widens as it descends. It arises from posterior surface of tibia. Nerve supply is from S2 and S3. It is a plantar flexor. Superior extensor retinaculum. It binds down the tendon of tibialis anterior, extensor helicolis longus, extensor digitorum longus. It is attached laterally to lower end of fibula and medially to anterior border of tibia. Inferior extensor retinaculum. It is Y-shaped band. Its stem is attached to the upper surface of calcaneus. Coming on to summary, knowledge of the position and action of various muscle groups is of extreme importance to a physical education student, as unequal muscle pull is one of the most commonest causes of deformity. Paralyzed muscles must always be supported in the position of function, which also prevents contractures in the unaffected groups. The practical applications of efficient splintage can only be achieved by an intelligent understanding of muscles. With this, we bring our today's lecture to an end. I hope this must have lifted up your concerns about this important concept. Thank you. Have a nice time. Goodbye.